Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk today a little bit about the subject of loose teeth, because I've been asked many times, can loose teeth be saved? Well, yes and no, depending on the situation. So many times we have patients who come in, they come in because they were told their teeth have to be extracted because they're very, very loose. Here's a good case right here. Almost all the bone is gone around these lower front teeth. But my own belief is that if we can stop the disease process and save the bone, even though those teeth are very loose, that we have a very good chance to save those very loose teeth. On the other hand, sometimes teeth are very loose. And why are teeth loose? Teeth are loose almost always because of periodontal disease or gum disease. Therefore, if we can stop the bone loss and stop the periodontal disease, we can save the teeth even though they're loose. We may not be able to get the bone back, but if we don't lose any more, we can probably save those teeth. But sometimes teeth are very loose and have lost so much bone that it would be dangerous to try to keep them. They may be adjacent to good teeth, and by keeping those, you're endangering the good teeth. And in those cases, it's wisest not to try to keep those teeth, but to remove them and replace them probably with a dental implant. So in cases where teeth are so loose that they can't be saved, and that does happen sometimes, less in my practice than I think frequently occurs elsewhere, because I try to save every tooth I can save. I believe in saving teeth, but sometimes a tooth can't be saved because it is so loose and endangering other teeth that it has to be and should be removed. If you'd like to know more about the procedure that we use for treating these very advanced cases, we use something called LANAP, or it's a laser procedure. It's extremely effective, minimally invasive, in my opinion, is the greatest way to save teeth, loose or even if they're not quite loose yet. And we have a link that we are providing for you if you want to see more about the LANAP procedure. Now, sometimes a tooth is loose because it's actually fractured. And a fractured tooth almost can never be saved. There is one other possibility. If it's fractured just around the top, sometimes that top can be removed and you can reshape the gum around the root, and then a crown can be put on that tooth. But most of the time, if a tooth is fractured, that tooth is going to need to be removed and replaced, preferably with an implant. And when teeth are loose, very often we'll splint them, like these lower front teeth here, which are loose. We'll splint these teeth from the back with a material. It won't show, but it'll stabilize the teeth so that they're no longer loose, and the patient will be more comfortable with them also. Try to keep your teeth. That's what our goal is. Stop gum disease. If you can stop gum disease, you can usually save those teeth, and that's what our goal is. So remember, if you have a healthy mouth, you're going to be able to keep a lot of these teeth, and more importantly, maybe your body is going to be healthier. So call us, contact us with questions, subscribe to our YouTube channel. We'd love to hear from you. We really care about you, and have a great day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.